All right, good evening everyone and welcome to my live today. So as usual, we are going to be answering your questions, medical questions. We are going to be having only 1 hour for today, and therefore I would wish to have questions very brief. They should be very brief and on to the point. All right, today is 12th of October 2023, and we begin our live right now. Thanks so much for loving Ask Dr. UTHUMAN YouTube channel. Our channel is really growing and I'm so happy about that. But most importantly, I feel happy when I see people being helped, those who have not been, who are not able to, before we are not able to conceive, they are able to conceive because of probably a little advice we give. So I feel so happy, and therefore I thank you for always asking your questions and you getting helped. So let's straight away, guess back. Let's straight away begin with question number 1 here. I see many of you are here. I think it's that internet, because even YouTube. Yours is fine. Okay, so let's straight away go to question number 1 here. Santosh is saying, when can I take pregnancy test? So a pregnancy test should be taken after 14 days of fertilization. So 14 days after fertilization, you can take a urine pregnancy test. However, like we said, even if you use blood or serum, you can take a pregnancy test at 10 days or even 70 days. So for the serum or blood test, it is so sensitive and it can start from 70 days. And we've also seen some strips of serum that can detect pregnancy of 5 days. But if you're using these normal urine dipsticks, the normal urine HCG strips, You have to check after 14 days. Let's get another question here. This one is called Mulungi Olivia, hydrosalpinx after laparoscopic surgery. Oh, sorry about that, because we usually want to use laparoscopic surgery in case someone has hydrosalpinx. So if you still get hydrosalpinx after laparoscopic, then you have to go back, or you have to go back again and do that laparoscopy. So the laparoscopy has to be repeated. Then Agunwa Veronica is saying, good evening to you. All right. Doctor, please answer this. If pregnancy text is not all too dark, one is dark, is it positive? So you see now it depends on which test you're using, on the test you're using. If you're using these pregnancy test strips, they are all supposed to show, but some you may find that one is faint. So if it's faint, we tell you to give it more 1 week. If you give it one more week, then you can do the test again. So if one is thick and another one is light, or another one is faint, then give it another week and test and do the test again. Okay, so we have Jacob Ochana is saying, we are ready, doctor, right here. Susan Ayob is saying, Susan Ayuba is saying, please doctor, what can I take to have more libido? Because I don't have feelings for my husband. All right, Susan Ayuba, how old are you? Because at times low libido comes with age. But most cases, it's as a result of low levels of estrogen. By the way, for women who have low feelings, who do not have feelings for their husband, there are a lot of things we need to ask ourselves. Number one, because at times, you see, these feelings are psychological. I have discussed with several women that will tell you that I used to have good feelings for my husband. Every time I could just think about him, I even feel some waters down and so on. But when my husband cheated on me, okay? When my husband cheated on me, from that day up to now, my feelings disappeared. So this happens, especially when something happens, if maybe it's a psychological issue that has happened between you people. And at times you may not even realize that it is this psychological issue. Maybe someone did something to you. Something happened, someone cheated, someone beat you, you were beaten by someone, or your spouse did something wrong to you. And then maybe you forgave. But there is something that remains deep, because there are some people who will, because we usually say forgive and forget. But some people do not forget, and that still remains intrinsically there. And therefore a woman may lack feelings for their spouses. So I usually tell them, or ask them, that you do not have feelings for this particular individual or everyone. If you don't have feelings for every man, you don't have feelings for every man, then that's when we look at low levels of estrogen. But if feelings are for only one person, I'm not saying that you should go and cheat and find out whether you have feelings for the other person. But if the feelings are if the low feelings or the low libido is unidirectional, then that is a psychological issue. If it's like it's to everyone, to every man, you don't have feelings for every man, then that is an issue to do with hormones, and that is estrogen levels being low, and therefore you can take estrogen supplements. But of course, before you take that, you are advised to go and do a test, an estrogen test. If the levels of estrogen are low, then you can take medicines to sort that issue of low libido. Fatima Yusuf Usman is saying, please doctor, if okay, I'm getting to your question. Okay, this one is Fatima Yusuf Usman is saying, doctor, please answer this. If pregnancy text is not okay, I've answered that. Maimuna Jalo is saying, good day, doctor. I want to ask whether you can be pregnant and menstruating. No. You can't menstruate when you are pregnant. However, there is what we call, some women can see some little blood during pregnancy, and that can be implantational bleeding. It usually happens at 14 days, okay? In the second week of after conception, after fertilization, they can have implantational bleeding. Therefore, they will have some light bleeding somewhere there. But also, if you get that bleeding during pregnancy, then it can indicate something else. Maybe you have what they call placenta previa, you have an abruptio placenta, you have, in other words, it is bleeding in pregnancy and it is pathological. Or maybe you have low levels of progesterone and maybe you're going to have a missed abortion or you're going to have a miscarriage. Then, so in other words, when there is bleeding during pregnancy, then it indicates danger. There is something wrong happening to your pregnancy. So what I usually advise is for you to go and do tests, to go and check with the doctor, to examine you to find out what's wrong with your pregnancy. So low bleeding or bleeding during pregnancy is pathological. There are very few cases, like I've mentioned, there are very few cases where bleeding is physiological, and that is implantational bleeding. Then we have Jacob Ocha. Okay. Chidima Ruth is saying, is it? Hey, I'm not getting you. Let's read this question. He's saying, is Dostinex 0.5 effective for treating prolactin? Yes. Dostinex can be used to lower the levels of prolactin in blood. So it can treat hyperprolactinemia. Women with hyperprolactinemia, they can use that. It cannot, it's like, they have been talking about the carbagorins and so on. This is just a drug of that nature, carbagorin and bromocriptine. Then this one, Godi E jokes saying, please doctor, is it possible to carry pregnancy for 11 months? Is it possible to carry pregnancy for 11 months? You see, for us, when we are calculating pregnancy, we use weeks of amenorrhea. And first of all, 11 months is not possible. It is not possible. That is post-term already, and there may be a problem somewhere. But at times, the problem is that you have a poor calculation. The way you're calculating your pregnancy is not the right one. Because someone will tell you, they will start calculating for them, because when they meet with a man, now they start calculating from there. Okay? And that is the problem. Some people will calculate that I didn't see my menses in January, so therefore now January 1 to Feb, March, April, May, June, July, August, and that. That's how they will be calculating the length. That's how they will be calculating the gestation age. Okay? But that is not how we do calculations for the pregnancy or the gestation age of the fetus. We do it by how? You look at the first day of the last menstrual cycle. The first day of the last menstrual cycle, that's when how you start calculating, where you start calculating from, and you calculate in terms of weeks. So a pregnancy shouldn't go beyond 40 weeks. So it's 40 weeks, and the pregnancy comes to term. In other words, when you reach 37 weeks, the baby is already fine, you can deliver at any time. So from 37 weeks up to 40 weeks, that is the time range we give for you to deliver. So if you don't deliver within 37 to 40 weeks, it becomes post-term. Post-term or post-datism can go up to 41 weeks, but not more than 42 weeks. When you reach 42 weeks, then an intervention has to be made, either by doing induction of labor or doing a cesarean operation. Janet Mwenda is saying, I have polycystic ovarian syndrome and I don't ovulate. What medication can I take? I did all tests and I was found with polycystic ovarian syndrome. All right, yeah, if you confirm that you have polycystic ovarian syndrome, then you're supposed to take medicines like Rimona, medicines like Pecos. medicines of that nature. But of course, like you're saying you did all the tests, I hope you also did a fertility hormonal assay, because with polycystic ovarian syndrome, you're also supposed to check on the levels of your hormones and also do blood sugar test. You take for the sugar levels, because in some people we end up giving them metformin, we end up giving them other fertility supplements like clomiphene and so on. So you have to look at that also. Then this one is saying, this one is saying, good evening, doctor. I am Mase Mwere, 30 years from Zambia, and I just want to ask, I have been married for the past 2 years, but I'm not conceiving, and I have no child. Okay, Mase Mwere. All right, you've been married for 2 years, you're not conceiving, you are 30 years. All right. So now, what you are supposed to do, Mase, is to go to the hospital and run tests. I've always said it here that if you're not able to conceive, you're not conceiving, you are advised to first run tests and find out what is causing that. And these tests are easy to do. So Mase Mwere and all those people out there who are planning to get pregnant and they have failed, one, I want you to go and do a pelvic ultrasound scan. After doing a pelvic ultrasound scan, go and do a fertility hormonal assay. Is everything okay? Is everything okay? So, you run the fertility hormonal assay, you do an HSG X-ray. So, in other words, you have to first do a fertility screen. And by the way, possibility of also having your husband infertile is also, it's also possible that your husband may be infertile. Therefore, as you're doing those tests, make sure that you also do a semen analysis or a sperm analysis to confirm whether he's fine, and you also get the medications. So we are left with a few minutes for those on TikTok. We have how many minutes? All right, so we have 10 minutes for those on TikTok. Please, when 10 minutes pass, TikTok will be getting off, so you just go and join our YouTube and then start the live will continue on YouTube. But we are still continuing 10 minutes for TikTok, but on YouTube we are still there. All right, so we have Mary Shomi is saying, Doctor, I am 40 years old and I've been with ups and downs of life, okay? I am planning for God's will. It's time to have a child, all right? But this month, I can't see my period. I don't know if menopause has started. Yeah, Mary showed me it is possible that menopause has started. Because some people receive menopause as early as 40, as early as at the age of 40. They can receive menopause. So it's possible that menopause has started. But even if menopause has started, that should not stop you from getting pregnant. It is possible we can still induce menstruation. Menstruation can still be induced and then you conceive. So that shouldn't worry you, but that it is possible that menopause has set in, or maybe you have some stress or anxiety, or even maybe you have low levels of progesterone, because all even fibroids, they can put then I have many questions here. Questions are really flowing. Doctor, what should I need to improve my sperm count? All right, with sperm count, men who have low sperm count, you can use medicines like sperma. You can use medicines like sperma. You can use medicines. Is YouTube okay? All right, you can use medicines like sperma. You can use medicines like Ziman. You can use medicines like Manix. All those ones can be used to improve your sperm count. Then this one is saying, Mwenda, question, it's here, it's running away. Okay. Janet Mwenda is saying, I have one child who is 13 and I want another one. All right, go on, Janet, what's the problem? Go on and conceive another child. Good day, E. Jokes is saying, Doctor, pregnant for 11 months, what do you suggest, please? What I can say, it is not possible for someone in a month, okay? That's even, I don't know, it's too much, because we call it postdatism or postterm when it reaches 42 weeks. So if we are now talking about 11 months, that's already beyond. Maybe that's a wrong calculation. We have a wrong calculation somewhere, but I advise you to go to an ultrasound scan and do an obstetric ultrasound scan. Let the radiographer scale for us. Let the radiographer date for us that pregnancy, and also we get the biophysical profile of that fetus. Okay. Agunwa Veronica, how are you? Where are you? Agunwa Veronica is saying, please doctor, what is the meaning of cervical closed os when I'm not pregnant, and what does it mean to a woman that has not been pregnant for once? If the cervix is closed, if the cervical os is closed, then that will be very, very hard. Very, very hard for a woman to conceive. And that condition is usually called, or is called Asherman's syndrome. At times it happens to the whole length of the uterus, but it can also happen at only the level of the cervix. So that is called Asherman's syndrome. And if a woman has Asherman's syndrome, it becomes so difficult. But Miss Veronica Agunwa, there is a solution if your cervix is closed. What you're supposed to do, go to the hospital. They will perform what they call dilatation and curettage. Dilatation, that is expanding, and curettage, and removing what is obstructing the pathway. D and C will work for you, and your cervix will be open. Just go to the hospital. Then we have Petronella Matera is saying, good evening, doctor. How can I increase ovulation in my hormones? I am unable to conceive. I only produce white mucus, not egg-like. So if you want to improve your ovulation, but at times most of you fail to get pregnant and think that you're not ovulating. Okay? All signs, because I've always talked about the signs of ovulation, all signs of ovulation may not be obvious. They may not be obvious. But if you want to increase ovulation, then you're supposed to take medicines that contain luteinizing hormone. Medicines like letrozole and clomiphene, and all medicines of that nature. They can help you to increase the luteinizing hormone. But I hope the problem is with the luteinizing hormone. So what I suggest is to first run a test, to first run an LH test to find out if the luteinizing hormone levels are low. If they are low, then you can go on and use the medicine. Sharon Muwowo is saying, doctor, what medicine can I take to open the tubes? Sharon Muwowo and whoever is watching, there is no medicine. I want to repeat this. People are being lied. There are a lot of quacks moving around telling people that there are medicines that can open fallopian tubes. They are not there. There are no medicines, there are no drugs that can be swallowed, or injections that can be given to open your fallopian tube, or to open the fallopian tubes. That stuff is done physically. It is done physically by unblocking the tubes, either using laparoscopic surgery, or doing open surgery, or doing hydrosalpingolysis or cannulation. I've always repeated it here. Those people are lying. You cannot use medicines. You cannot swallow medicines and open your fallopian tubes. Let this sink into everyone's brain that there is no medicine so far. Right now, as of now, there is no medicine that is going to help you to open the fallopian tubes. If tubes are closed, if tubes are blocked, the medicine is number one, hydrosalpingolysis. Either those people telling that they are flushing tubes, yes, that is one method. Number two, cannulization or cannulation. Number three, doing laparoscopic surgery or open surgery. There is nothing like this medicine, like this tablet, that can open blocked fallopian tubes. I hope that is very clear to everybody. Drichi Ubuni Isaac, please doctor, what causes a lady to menstruate for a month? Oh, meaning having periods for a full month, then that is abnormal, and that is likely to be probably hormonal imbalance. Someone may be having hormonal imbalance, problem with their progesterone estrogen balance. Family planning methods, some people using hormonal family planning can have that problem. Hormonal methods of family planning like injector plan, like Jadel, all the implants, hormonal IUDs, pills, and so on. Those ones can cause. Even also women who use emergency contraceptive pills. Emergency contraceptive pills can also cause bleeding, prolonged menstrual bleeding. Okay. Cheten Shiranga is saying, what medicine can improve sperm count? I've already told you medicines that improve sperm count. I've already said that they include sperma. You can have sperma. They include Manix. They include Zeman, and so on. Those medicines can be used to increase sperm count. Gaji is saying, my period comes 6th October. My period comes on 6th October. When exactly is my ovulation day and the date? Gabi got you. You see, we cannot know when your ovulation day is by just giving us the day you saw your periods. We need to know the length of your menstrual cycle. So give us the length of the menstrual cycle, then we shall be able to tell you the day you're going to have your ovulation. Let me pick 1 or 2 questions on TikTok before we leave them. Okay, this one is saying, Van Shira 1 is saying, Doctor, please, I had HSG and it said blocked tubes with intramural fibroid. Only have 1 tube left. Yes, all right. So what's the question? Surgery was recommended, but I missed my period and it's testing positive. Congratulations. Now, if you have blocked tubes and you test positive for pregnancy, that is very good, because like I've already said, that 1 tube can still enable you to conceive. Having 1 tube can still enable you to conceive. So that is good. And if you have a fibroid, there is no problem. Continue with your pregnancy. Just make sure that that pregnancy is being managed by a gynecologist or a doctor. You go to the hospital, make sure that your pregnancy is being managed very well. Why do I Zara Maldina, you're saying, why do I produce high dosage of Litrazole? Now, there are very many factors, because the reason as to why first of all, I don't know why they gave you Litrazole. Maybe you had very low levels of FSH or LH, and that's why they are giving you Litrazole. And probably the Litrazole, you may be getting a dose that may not be adequate for production of enough follicles. Then secondly, you may be also having probably issues with your anti-mullerian hormone AMH levels. So I would suggest that maybe you do fertility hormone. As I know you must have done that, but because I don't have those details, I may not know why you are producing only 1 egg. But probably the dosage may be low, or you have low AMH levels, etc. etc. Some sounds. All right. So let's have. I will accept 1 person and then we straight away go to YouTube questions. Okay. Okay. Hello? Yes, hello, how are you and where are you calling from?
I'm Sam, I'm calling from Uganda.
Yes, Sam, how are you?
My question, I'm okay.
So what's your question?
Just the is that after a woman conceiving, like if a woman has conceived, how long will a woman take to see her signs of pregnancy, or how long will you take to test that she's pregnant?
All right, thank you so much. And that's the last question on TikTok. It takes 14 days, okay? When a woman conceives, within 14 days, when you do a urine pregnancy test, you will be able to detect that she is pregnant. That is number 1. If you've used a urine pregnancy test, that is a dipstick. But also, if you use a serum pregnancy test, there are those pregnancy tests that use blood. That one can detect pregnancy as early as 5 to 7 days. okay, if you've used blood. What do you mean by seeing the size? The belly getting a bump.
The signs of pregnancy. After conceiving, a woman see the next day the signs of pregnancy, or after which period?
What do you mean by seeing the size of the pregnancy? I don't get the question clearly.
I say the signs of pregnancy.
Signs of pregnancy. Signs of pregnancy can begin as early as 2 weeks. You can't see the pregnancy signs in 1 day, 2 days, no. As early as 2 weeks. That is when the HSG levels start going high. Human chorionic gonadotrophins, the levels start going high, and when they go high, then you start having those signs of pregnancy, the early signs of pregnancy. It's the HSG levels and also the progesterone levels that start going high, and then a woman starts getting the signs of pregnancy. So when you conceive, it takes 14 days, and then signs of pregnancy start coming in. All right, thank you so much, and I would like to say bye-bye to those on TikTok. We are continuing our live program on YouTube. So those of you on TikTok, please switch and go to YouTube. Search for Ask Dr. UTHUMAN. We are continuing our live right now. Bye-bye. Nice time, those on TikTok. See you. Yes, take it off. It's not getting off. You can take it off. All right. All right. Let me continue with my guys on YouTube now. This one is saying, "Hello, Dr. Aminat." You're saying, "Hello, doctor. Do all breast discharge indicate high level of prolactin? I do ovulate and I see my periods normal, but I have been having breast discharge for 2 months now due to clomid. A doctor gave me 2 months ago." Now, not all as a result of high levels of prolactin. Some of them may be infections. When someone gets mastitis, someone can get mastitis and have issues. And have issues with their can have mastitis and have issues with their prolactin, with discharges from the breast. It is only high levels of prolactin if that discharge is purely milk, okay, is breast milk. But sometimes it's past discharge, or it's just a serous fluid that is caused by mastitis or any other mass or something wrong with the tissues in your breast. Then Nsubuga Alex is saying, "Ate ani atawanya omusawo." Who is this? There is no one disturbing me. Subuga Alex, how are you, my brother? Justin in a video, "And why is it that whenever I do a pelvic scan, always they say that I have cysts on my ovaries? Does it mean that I have polycystic ovarian syndrome? I'm trying to conceive." No. When they say polycystic ovarian syndrome, we mean that we have very many cysts, okay? Very many cysts. In other words, instead of you having eggs all over in your ovaries, you instead have cysts. You have balls with fluids inside, but not eggs. That is what we call polycystic ovarian syndrome. Okay? That's what we call polycystic ovarian syndrome. But they can tell you that you have an ovarian cyst. Ovarian cyst, it may be 1 or 2. That will not indicate or will not mean that you have polycystic ovarian syndrome. So these are different things. There is polycystic ovarian syndrome. There is also an ovarian cyst. Good evening. This is Treasure Diamond is saying, "Good evening from France." All right. Say hi to those saying hi to those ones watching from France. This one is saying Pinku Sahu is saying, "Please, sir, however, increase your chromosome." Sir, however, increase Y chromosome. I don't understand your question. Pink Shaho, make sure that you ask that question again. I don't get it. "Doctor, how can I induce menstruation?" You want to induce menstruation. In menstruation now, first of all, we must find out why you're not menstruating, okay? We find out why you're menstruating and then treat that. But of course, in most cases, we use progesterone analogs. So you use medicines containing progesterone to induce menstruation. That is the simple answer, but of course that's not how we just do it. We may need to do several tests before that is done, but we use progesterone to do that. Mulungi Olivia, hello doctor, can you do cannulation after laparoscopic surgery? Yes Mulungi, you can do it. I repeat that. Margaret Nduwati, hi doctor, I removed my implant 5 years ago. 5 years in 2021. No, you can't remove an implant 5 years ago and you're saying in 2021. Today, this is 2023, so those are not 5 years. I removed an implant 5 years ago in 2021. No, if you removed it 2021, those are 3 years now. Actually 2 years. And since then now, I have received my period like 10 times. What could be the problem? I'm trying to convince. You're saying conceive. All right. So Margaret Ndauti, an implant contains a hormone levonorgestrel, and that hormone interacts with the intrinsic hormones, all the hormones in your body, and cause hormonal imbalance. So it's the hormonal imbalance bringing all that. What you are supposed to do is to carry out a fertility hormonal assay, identify the derangement in your hormones, and get medicines. Aminat is saying, I did a scan and they said the internal cervical os closed. I think I've answered this one. Or it's a different person, but having this. All right. Let me see the question. I did a scan and they said the internal cervical os closed. Uterus is bulky with 4.3 centimeters, no fluid in pouch of Douglas, and the impression is features of pelvic inflammatory disease, which I did. So what is the question, dear? Aminat, what is the question? You've given us the details, but the question is not there. Mabru and Mahfudida. Mabru and Mahfudida, where are you? You're from which country? This name is interesting. Mabru, I am from TikTok. All right, okay. Erisi Naigaga, hello doctor. Mabru and Mahamufuda, saying, please doctor, what is the difference between bubbly urine and foamy urine? But wait, Maburi, which country is that? Which country is that? Where are you? This I've really not had this name for. I want to know the country where you are. But you're asking about bubbly urine. That is urine which comes as a result of dehydration. People who do not take enough water. If you're not taking enough water and you're dehydrated, they tend to have such urine. Okay, such urine. And for the foamy urine, it's urine which contains foam, all frothy. So I don't know what exactly you want to know, but bubbly urine, that one is usually as a result of dehydration. But there are also some conditions that can cause that, conditions of nephrotic syndrome and so on. That is why I don't want to go. But for foamy urine, it's like you have foam. I don't know if you understand foamy urine. Foamy urine is like your urine. It's like when you put soap in water, it forms some foam, and that kind of urine of that nature is called foamy urine or frothy urine. So I don't know exactly what your question is about, but that's Ankunda Daphne, hey doc, this is Daphne. I always have a sharp pain in the lower sides of the abdomen, and I have tried to get pregnant but failed. What could be the cause? Sharp pain in the lower sides of the abdomen, that is usually a PID, an ovarian cyst, or anything of that kind. So I ask you to do an ultrasound scan. It will be able to detect for us what is there. You're saying you're unable to get pregnant. Yes, that if it's a PID or a cyst or any mass, it can cause infertility. But also you need to do several tests. I know you know those tests. You're supposed to be what we call the fertility screening. Those fertility tests that can be done to find out what is causing your infertility. So the tests you can do, like you said, you go and do an ultrasound scan, but you're also going to do fertility hormonal assay. You go and do syphilis test and so on. Then you'll be able to identify if there is any problem that is stopping you from conceiving. Janet Mwenda is saying, how do I take clomiphene? I was told to take it at the same time every day for 5 days. Is it right? I'm having abdominal pains the day before ovulation. Is it right? You say clomiphene. Taking clomiphene, when to take it depends on the length of someone's menstrual cycle. For example, if the length of your menstrual cycle is just 21 days, you cannot take clomiphene on the 50th day. Because on the 50th day, you will already be in your fertile days. Actually, a person with a 21-day cycle has ovulation on the 7th day. So taking clomiphene on the 50th day has no importance. Therefore, if you're taking it on the 50th day, probably the length of your menstrual cycle may be around 29 or 28 days. So taking clomiphene, when to start taking clomiphene depends on the length of your menstrual cycle. Nsimirwe 44 Christine is saying, hello doctor, what is the first symptom of labor? This is a great question. Now, it is difficult. Many people, every woman has can have different signs. The signs can, like, because normally, if we go normally, the first sign of labor should be a show. A show. It's called a show. A show is some discharge or fluid that is mixed with blood. A little bit some whitish or colorless stuff mixed with blood and so on. That is a show. When it comes out, that starts all. It's what initiates labor. However, some women will begin with lower abdominal pain and back pain. So it is either this show or the lower abdominal pain or the back pain that can show that you have this labor has started. Then we have Aminat is saying the urine MCs and HVS I did said I have moderate growth of staphylococcus. You see, Aminat, you break your questions now. I don't remember what you had told us. What is your question exactly? I'm failing to get you. Mary Mensa is saying FSH is 7.88, LH is 10.3, and when can I do progesterone test? I've always told people that do those tests at any time of your choice, at any day. Because at the end of the day, because we interpret these results depending on when you did this test. If you do the test when you're menstruating, we shall still interpret results and correlate them with the normal ranges when you're having menstruation. If you do, in other words, just go and perform the test, but make sure that you note the day you've done that test, so that we can know that you did it during the menstrual cycle, the menstrual phase, follicular phase, or you did it during the whatever phase, follicular, luteal, or so on. So just go and do your test. I've always found people telling others that, you know, you're supposed to do this progesterone test during this time. No, do it at any time of your choice, as long as we've noted when you've done it and we are able to correlate the results. Kasim Yahudi saying, good evening, Doc, writing from Zambian. When should I repeat pelvic ultrasound scan after being treated for pelvic? 2 weeks. Because usually that treatment takes a period of 2 weeks, 2 to 3 weeks. So when the treatment is done, you can now repeat the ultrasound scan. Those of you who are new on this channel today, please don't forget to subscribe to our channel. Subscribe and press the notification bell so that you can be notified of any video we upload. And also you have a chance of becoming a member of this YouTube channel. Just press where there is join, become a member. A member has a lot of privileges, including inviting you on a one-on-one video chat with you so that you can list your problems privately. Then we have another question here. This one is called Hawa James, saying, hello doctor, I saw my period on 18th September and I started seeing it yesterday again. And I want to get pregnant. So what exactly do you want? I've not understood. Yes, you saw periods on 18th and you got periods again yesterday. You want to get pregnant. So what exactly, which advice do you need? Pinku Sahu, however, increase sperm Y chromosome. I don't get your question. Hope Natkunda is saying, great job, doctor, watching from New York City. Say hi to those guys in the New York. Then Mubra and Mahfuruda is saying he's from Uganda. Kesbag, have you heard of Mubra Mahfuruda? He's a Ugandan. All right. Jacob Ochan, hello doctor, the length of my menses of my wife keeps on changing. What can cause that? It can be as a result of hormonal fluctuations. It can be as a result of anxiety and stress. Team of 12. Do government hospitals are also testing hormonal or private hospitals? Yes, serious government hospitals test fertility hormonal as do fertility hormones. Yes, they do. Mabura Mahufuda is saying, how long should bubbles stay in urine? How long? They shouldn't stay there. We are not supposed to have bubbles in urine. It's a pathology. You may be having dehydration. So if the problem goes away, if you get hydrated enough, the bubbles will clear also. Vanessa Ahurira is saying, doctor, good evening. Please help me. I have been trying to reach you in vain. I have subscribed and I even man-chopped today. Your process has now taken 1 month. Vanessa Ahurira, please give us your phone number here. Write it very fast so that we note it. Sharifa, get a pen and write this phone number. So, Vanessa Ahurira, please give us your phone number and we follow up on this matter very fast. Vanessa Ahurira, please share your phone number and we sort this out very fast. Okay, then we have Janeth Menge is saying, I want to know if I have thyroid disease and I also have irregular period. Which pills have to use to conceive? Now you see, Janeth Ngeha, you have multiple problems. You can't just say you need just a few pills to conceive. One, if you have thyroid disease, we must make sure that there is no storm. In other words, we have to make sure that you are fine. You have to take the medicines for thyroid disease. Okay? If you have irregular periods, I would advise you to do a fertility hormonal assay. Let's look at the level of your hormones and then get treatment. So you don't need just pills before knowing your problem. Blessing Akpan, hi doctor, why I'm having protein in urine? Proteins in urine can indicate a problem. Number one, you may be having a UTI. You may be having a problem with your kidney, acute kidney injury. Go to the hospital. You'll be required to do a renal functional test. You can also do an ultrasound scan. That problem will go away. I hope you've done a urinalysis. That's where you got the issue of protein in urine. Adowabi Richard is saying, good evening, doctor, good evening to you. And Maburu is saying, thanks, doctor. Thank you too. All right. As we are winding up our live today, I want to get a number. Vanessa Ahurira, if you're still on live, please give us your number. We have to sort out this issue if it has happened to you. You know, we have a large volume of people booking for appointments, and if you really miss an appointment yet you booked it, it's quite absurd. But please Please just share with us your phone number so that we can respond to that as quickly as possible. Peron Ati, I have missed. Good evening, doctor. You've missed what? What have you missed? You've missed the live. You've come late. All right. So today I think we are left with 1 minute, and for those of you who are watching our live, please do not forget to follow our technician here. Is called it.next. Write for me it.next there. Please go to YouTube and follow it.next. He's a very good gentleman. He will be teaching you how you can use, first of all, your phone, a lot of things regarding information technology and so on. It's very good via that. So please follow him so that you can get that knowledge. it.next is your channel where you can get knowledge about information, about social media, knowledge concerning that. You have a problem with your computers, your internet has issues, you want to set up this, you visit that network. It's called it.next. Janet Mwenda, you're saying, thank you, doctor, you really help us. I would like to have an appointment. If you want to have an appointment, go to book an appointment on our website, www.druthman.com. We shall be right there to attend to you. Ahurira Vanessa, you've not sent your number, and we wanted to help you, but you've not sent the number. All right, I would say thank you so much. You've been good listeners, good viewers. Till we meet next time, God bless you.